Pula Vinaka and warm Pacific greetings to everyone who's listening in today. Welcome to the third webinar for Pride Month, an initiative of the U.S. Embassy Youth Council in partnership with the U.S. Embassy in Suva. So some of you joined us for the first webinar that happened the week before, where we had Krishnir Sen, Rhonda, and Marine Levu. And then last week we had Joey from Tongan Ladies Association, and we talked about LGBT movements in Fiji and the Pacific. We have talked about COVID and mental health. We have talked about the history of the LGBT movement, the priorities, and how we can be better allies. We continue the conversation today on this. This week's theme is LGBT and health in general. And this week we are joined by Dr. Joe, a medical doctor from Tonga, who is also part of Tonga Ladies Association. And we are hoping to be joined by Tebeo from Bimba and Kiribati. We'll listen to our two panelists on how the community is faring in terms of COVID, sexual reproductive health and rights, mental health, access to health services, and a whole set of topics that we discussed before that we feel is very important for us to know about as we go forward. Before we start our webinar proper, I just wanted to highlight that some of our topics may discuss some sensitive topics around mental health. So we ask that if you're going to join into our live session or on YouTube for the recording, please practice self-care. We will ask our panelists to highlight some contact persons in their countries that they could reach out to should the conversation trigger emotions or trauma that you feel you would like to seek support for. And please do feel free to seek those support if the conversation gets a bit heavy. Remember, our conversation tonight is open for comments and questions from our audience. If you'd like to ask a question to our guest speakers, please use the raise your hand option or drop myself. My name is Abdul on the call, or Talay, whose account is arcsuva@state.gov. Apart from that, we are going to go straight into the conversation today. Remember, send in your questions if you want, and I could ask on your behalf, or you could ask those questions yourself. So first off, I would like to ask Dr. Joe if he would like to introduce himself, such as the work that they do, apart from, of course, the medical doctor work that he does, but in terms of other health aspects that relate to the LGBT community, the organization that he may be part of, and what pronouns he would like us to use. I already know because we had the pre-call. So Dr. Joe, over to you.
Thank you, Abdul, and good evening to everyone from and warm greetings from the friendly island of Tonga. My name is Dr. Joseph Takai. People address me as Dr. Joe. I prefer he to be used as well. I am. It's an honor for me to participate in today's discussion based on, because it's Pride Month and it's talking on LGBT and also health in general. I play a role. I work for the Ministry of Health here in Tonga. I'm a medical officer that I'm looking after. I work for Communicable Disease section under the public health divisions for the ministry. And I tend to look after, well, it's communicable disease and infectious diseases. Part of my work is taking care of people living with HIV and also doing consultations for clients and those who are seeking treatment and management for sexually transmitted infection. And that's just one of the core duties that I carry out here in the ministry. We also look after the communicable disease section in general in terms of tuberculosis, outbreaks such as typhoid fever, looking at other illness such as dengue fever, which we don't at the moment. We haven't had any cases of those here in Tonga. But going back to the conversation and the topic of discussion today, I am also a member of the Tonga Ladies Association, and funny how you mentioned a first session talking with Joey Mataele. from the Tonga Ladies Association. I happened to sit down with Joey last week in one of our conference and our trainings here in Tonga, and we were just talking about the talk that Dale and yourself, Abdul, were organizing for Joey, and Joey mentioned me doing this for Pride Month and also having this conversation with you all. And here we are, and I'm so happy that I get to be part of it. I get to the Ministry of Health, which Public Health Division plays a role in partnership with non-government organizations and agencies such as Tonga Ladies Associations. We have another association, the Tonga Family Health Association. We work hand in hand together, targeting various vulnerable population, especially who are at risk for STIs and also are vulnerable for HIV. And the ministry is leading in the program, looking after HIV and STI, and the Tonga Ladies Association and Tonga Family Health. We work hand in hand together, targeting these vulnerable groups in terms of looking after our people living with HIV and those clients and people seeking help and treatment for sexually transmitted infection. And that's how I came across whenever we had issues and conversation about the LGBT community, I happen to take it to heart, because looking into and dealing with such community, they are also vulnerable population as well. And that makes the job easier from my side, because I tend to blend in and understand what these people are going through in terms of going through illnesses and such illnesses as well, and then I get to help them when needed. We carry out activities that involved the LGBT community, such as health educations and awareness. We also do testing. We also I get to do the health education for such for the to be done, and not just myself. I have a team in the hospital that we all look after such cases for people living with HIV. Myself, and then there's two other medical officers that we work under the section for public health divisions, and also we have assistants that do help us in terms of our service our services that we provide for such people, and also for the community and the general population of Tonga. And I think that's just a brief introduction on what I do and my role to play in terms of health in the LGBT community here in Tonga. We work so close with the Tonga ladies, and not just them as well, but we also work hand in hand with our family health association in looking after their activities and ours as well. I think I'll stop there, Abdul. That's a brief intros, and we'll take it from there when we do further conversations and the discussion today. Thank you.
Since we are on the topic of LGBT and health, my first question obviously would be, how has COVID-19 impacted the LGBT community health-wise in terms of accessing services, in terms of vaccination plans for Tonga, and other health-related issues for the LGBT community in Tonga specifically?
Okay. Thank you, Abdullah. I forgot to also mention in my intros that our team are also part of the ministry's public health team who are responsible or responding to COVID-19 pandemic here in Tonga. So as you can see, we are like the multitask team. But going back to your questions, yes, about how COVID-19 pandemic is affecting or impact on the access of such communities, LGBT community, and even the general public in population in general, accessing to health services. I must say, at the moment, Tonga is still COVID-free to start off with, and we are thankful for what the ministry have done so far, bringing us to where we are today. It's been almost, a year and a half, and I'm pretty sure everyone can relate to this from the Pacific regions, including Fiji, on how this pandemic is affecting everyone, not just a single person, but a group of people, and even the country at large. So since we're still COVID-free, here in Tonga, the service that we provide, we're still catering for people, and we're thankful that we don't see or experience the COVID-19 outbreak or pandemic here in Tonga as we can compare to what's going on in Fiji at the moment. So that the impact that we see right now is not that bad as compared to what's going on in Fiji. But with that being said, at the moment, what the country is doing, we're preparing ourselves for when, God knows when, COVID-19 is going to enter the country. We are getting our ministry ready. We're getting our healthcare worker ready. We're getting as much as we could at the moment. I'll take back to what, as an example of how this COVID-19 pandemic impacted us at our situation now. Last year we had a lockdown, and that was the first time that we experienced a lockdown here in Tonga. And it happened between the month of March to April. And this was because when the COVID-19 outbreak was starting to spread all over the world, and it started to appear in New Zealand, and then we started reacting to this from the government and also the ministry as well. And that's the first time we experienced a lockdown, and that's when we started to see how this pandemic affected populations and even LGBT accessing services. First thing that we realized from that lockdown, it went on for almost a month. I think we started off with a week, and then we expanded to 2 weeks. We wanted to make sure that the flights that we had prior to the lockdown were looked after. The passengers that came into the country were also were followed up and things like that here in Tonga, especially in their homes and even to the small islands. And then we started to realize that when this lockdown actually happened, people were confined to their homes. Our services were actually being affected, such as people coming in for consultations, getting their treatment, such as medications from the hospital, even the pharmacies and all that. That was we saw that happening at the time, but lucky we tend to address it beforehand. We made sure that people are getting their stock right before lockdown, and their supplies that can last them throughout the period of lockdown that the government were targeted at the time. In terms of the LGBT community, the impact that we saw from the lockdown last year is that we had activity planned. We have the activities planned throughout the whole year, such as getting our routine health educations and awareness outreach on STIs, HIVs to our target population, such as not only here in the main island, Tonga Tapu, but also reaching out to the small islands. Those activities were not done. They were either delayed or it was postponed to some other time. not only that, but also our services such as our testing, because we had our routine quarterly testing for HIV, for LGBT. I think Joey has mentioned it earlier. If Joey hasn't mentioned it, then this is what we came across. Those quarterly testing, they were not done as well, and they were delayed. So all these programs and activities that were scheduled and were routinely supposed to be done last year during the lockdown, it was affected because of the pandemic. And then as we went along throughout the whole year, then we started when we were managing to control our borders, especially our airport and also our seaports. Then we started to loosen up those strict lockdown intervention that were happening last year because of COVID. And then from there, then we started getting our essential services coming back slowly to normal, or to function normally. And up until this year, and with what's going on at the moment here in Tonga, the country is still on we're still working under our emergency state control in general. So even though we're starting to loosen up with our restrictions, but at the same time, we are still under that emergency state from the government, and we're working just accordingly to that. And so right now, we don't really see the impact of the COVID pandemic to our services that we provide, but then we are getting ourselves prepared for what's gonna come. So that's what I can just share with you on that first question, Abdul.
Thank you, Dr. Joe. And I got a question from Sheldon, who's on the call, and this is in relation to a very general question, which is there vaccine hesitancy in Tonga, because a lot of countries in the region are rolling out vaccinations for, so that we can go back to normal or the new normal. Is vaccine hesitancy a problem? Do you think that there is a problem within the LGBT community, or is the uptake of vaccines okay? If you could provide some feedback on that.
Yeah, thank you for that questions. Yes, we our vaccine rollout started last month. We launched we're using AstraZeneca vaccine here in Tonga from COVAX, and we started the rollout of vaccine in May this year, last month, and it was a success. And we managed to get a full coverage of all the doses that we first received from COVAX over a month. Our second dose, we managed to cover 28,000 people, especially the target age group and the populations. It was covered. At the moment, we are going to start our second dose this coming week on Thursday. And that is going to start off with our frontliners, including ourselves, the healthcare workers. It's beginning next week. And then from there, the rollout for our second dose is going to happen. In terms of vaccine hesitancy, we experience the same here in Tonga. We have people questioning the vaccine still, and then we still have the church. Some of the churches, not all, only a few, are going against it as well with their own informations that they provide to the people in general, especially on social media. I'm pretty sure it's the same as what Fiji is going through, but then what we have here in country is that we have a communication team in the ministry that consists of our public health doctors and our nurses who have done the work right now is doing the same thing. They're trying to get the message across to people no matter what, even though we still have people who resist or hesitant to take the vaccine. But then again, we still push through with our health talk and our communications to people for vaccine, and yet we managed to get our full coverage done for our first dose of AstraZeneca that we received. And now we're moving on to the second one. And then last week, the nurses and the teams that are doing vaccinations meet up last week to plan and schedule their time for the second doses to be done this week. They've done their layout already. Now we're just going to see, starting tomorrow, how we're going to distribute our team and start our vaccine rollout. But yeah, we still have the people who resist and are hesitant, but some are remain silent and quiet. Some they speak up. They have the guts to say out what's in their mind and what do they want to say on social media, and some goes on TV and radio. But then again, at the same time, we want our communication team are on the other side doing what they're supposed to do, getting the right information across to people at the same time.
Thank you, Dr. Joe. And remember, you can keep your questions coming in. We have had one or two questions that I will pose. So one of the things I also want to ask is, with what's happening with COVID, lockdown, people losing their jobs, and this, of course, specific to the LGBT community, how important do you think is the partnership that governments and ministries have with organizations such as the Tongan Ladies Association, and how can we nurture that kind of relationship at this time of the pandemic?
I believe it's very important to keep the relationship between the non-government agencies such as the Tonga Ladies Association with the current government and what's going on now. At the moment, like I mentioned before, there is partnerships already between the NGOs who are playing the same role in sexual and reproductive health with the Ministry of Health, and the connection is already there in place. What we need to do is to strengthen that and make sure that the participants and that the leaders from these agencies are speaking up, and what they have, they actually stand their ground with what they needed to do, what they want to do for their community to actually save them from such an epidemic and pandemic. And if it somehow arrived here in the country, what are the consequences that we'll face, and what can the government help, especially the vulnerable populations and all. So at the moment, like I mentioned before, we are in the preparations. We're actually past. We're actually moving forward with what we're discussing now, and and keeping that in mind, that these associations are actually working with the ministries such as Ministry of Health. The Tonga Ladies Association also works hand in hand with Ministry of Internal Affairs, even Ministry of Justice as well, in terms of looking of tackling domestic violence and things like that. That those problems will arise from such a pandemic that we have experienced in some other countries, and that's what we learn from here in Tonga. We learn from what's going on in our neighboring countries and what they're going through, not just biological and physical, what they are affected mostly with COVID-19, but also looking into their mental health, looking at their social health as well. And yes, that's what I wanted to say, is that it's very important to keep that relationship, and it's still going on at the moment, but we just need to strengthen that by making sure that these leaders, such as the Tonga Ladies and other LGBT, those agencies, they stand their ground and they speak up what they want to speak up in their mind and what they need, and raise it up to those ministries, line ministries, who is the government today here in Tonga.
Thank you, Dr. Joseph. Since you mentioned mental health, and we did discuss this a little bit last week, but what has been, I mean, in general, what has been the mental health status or the feeling of people, with the restrictions in place and job losses and unable to get out of country or have their families and friends come over? One, what has been like, an outlook of the mental health status of the LGBT community? And I've got two more questions on that, but we'll start with that.
Okay, thanks. Before I answer that question, Abdullah, I must say I'm not an expert on mental health or have a background on that, but I happen to know that in the process of preparations, we also consider that side, our mental health in general, and also to such vulnerable populations like LGBT communities and all. We also get ourselves involved with our psychiatric and our psychologists here in the country, who is led by Dr. Mapapuloka and his team. They happen to also continue, and they helped us providing information across to the population, to the general populations, in terms of what can go through with COVID restrictions and lockdown, what people can go through in terms of separations from their families abroad, overseas, what people can go through whenever we are in a process of repatriating them from overseas, coming back to the country, and they go through quarantine, and all those, the duration and the time that they have to spend on quarantine to by themselves, or if they're coming in bubbles in their families or group, they will also experience such mental things in psychological and also behavior, going through all those processes. And Dr. Mapa and his team have also reached out, doing radio programs, talking to trying to get the message across to the population that they have to be prepared, because all these things will happen for sure. All the the signs, the symptoms of getting psychological or mental illnesses will come in if they are not prepared, and if they are not getting themselves ready for such behavior or such things to happen to them, they will be affected. And so what I can't put a number or a status when you said the outflow of mental status in such vulnerable populations such as LGBT, because like I said before, we haven't gone through the COVID-19 outbreak here in Tonga, so that we can actually see right through. But then again, this is what we've learned from from the neighboring countries and what's going on in New Zealand and Australia, that we got those informations, and when we try and get that across to people and get them prepared in different levels, because different age group will experience different kind of mental illnesses in what they've come across in a younger population as compared to our older populations. Again, see, those categories and things will have to be addressed in such a way that it can cover, it can also be understandable and provide information towards the public. That's part of our plan that we're doing now, is to include that mental health awareness for the Tonga Ladies Association and the other and associated agencies. That's our target, and that's our future plan, that we're hoping that we can also include that in our activities that we're doing right now, while we still can see them face to face. Then we have to carry out those activities for sure. Thank you.
Thank you. The other questions I wanted to ask is, in general, we understand that there's a little or maybe a lot of stigma associated with the LGBT community and HIV/AIDS. and that at times, prevents them from accessing health services. It could be due to socioeconomic reasons, it could be due to geographical reasons, or it could be stigma itself. So, one, how can we, what do you say, encourage the LGBT community to, one, go and access these services, and two, how can we sensitize the health professionals on how to interact with the LGBT community, keeping in mind the different diversities that they come from. And it may be sometimes difficult for a non LGBT or non suggest person to understand who a person is. So, how do you think, being that you're in the health sector, how do you think we can approach the stigmatization of the LGBT community and their accessibility to health services and facilities?
Thank you, Abdul. I think this is one tough questions you're asking here. It's in, but I'll try and answer if I could. Yeah, that has been a challenge. It has been in other places too. Stigmatization and discrimination of such a group of people and such communities are also happening here in Tonga. Tonga is still a what you call it, a very restrictive, very culture. The cultural traditional aspect is still very strong in here. Taboos, talking on sexual health is still a taboo in some of the areas here, churches as well, because of that's the current, that was in the past, and that's what it's been ongoing up until now. But then we have seen things change recently. People are starting to understand, and they're open up. They're very open-minded now. Speaking to me, like I work in a ministry and I'm a healthcare worker. I advocate on equality and having, and accepting whoever that is coming to seek for help in whatever ways, no matter if they are the gender that they are actually presenting to you. And I get the message across most of the time to especially the young ones, the young doctors and the nurses. We tend to loosen up a bit, with having that mentality of who are we dealing with in terms of working in the ministry, and looking into such behavior of being stigmatized. It's starting to, like I mentioned before, it's starting to loosen up. The community now in Tonga, they're opening to the conversation when we talk about LGBTs. For example, when we talk about ladies in the communities, or people, men, in such level. Like I said, this is a very hard topic to talk about itself, but then that's the only way how we can get the message across, is to continue the conversation and talk about it. Because if we do not talk about it and try to retain it to ourselves, my issues might not be, then we won't be able to address issues and things that are going through in an individual. For example, in an LGBT individual or community. But then again, what we encourage our young ladies, our trends, and even our MSM, who most of them, we encourage them to stand up, to come out, and they are included in these associations and what they provide. Tonga Ladies Association are looking after such population, such community, and they're doing a good job trying to get everyone coming in. They have a drop-in center. They have a place where they could house for people, for those that have been kicked out of their homes, and those that are looking for places to stay. In their drop-in center, they tend to provide care. They tend to provide all these informations and things that can help an individual in whatever means that in terms of housing, in terms of health, in terms of social, in terms of work. They provide that for people that needs that. And that's a very important job of work that they do. And I applaud Joey and Joey's team, Kuela, and all the members in the Tonga Ladies Association for doing that. And again, that a job might not be recognized for the whole country, but they're taking small steps, and then they're moving forward with what they do and the activities that they have done. But then coming to sensitizing the healthcare workers and looking into how they could get the services, to normalize the services they provide, to cater to be inclusive and cater for such community. Yeah, it's starting to work slowly now. It's just because we have people like myself who's in the ministry and has been working. We're doing our work. We're doing our work to the best that we could, and we're also advocating at the same time on trying to get that mutual understanding between all healthcare workers to face whenever we're going to face someone, especially someone who's coming in who's a trans or a lady who needs help. We have to attend to, just as similar to other people who are seeking help to the hospital. And yeah, we don't have to just discriminate and label people, but because of what they or who they are and in the way how they present to us. But yeah, slowly we're getting there, Abdul and all the listeners who are here today. And I'm so happy to be part of it, and I will make sure that I'll continue on doing what I do in the work that I do, and also advocating and making sure that my colleagues are on board in terms of providing services to everybody. Thank you.
Thank you, Dr. Joanne. I must say, I'm really happy that we have someone from the medical sector themselves to be answering these questions, because these are really good insight, I feel, for all of us on this call and those of us who are going to listen to this later. And I'm wondering if I can ask you this question. Because of how you identify, when you joined the workforce, was there any barriers or any difficulty in integrating into the workforce from your colleagues, on a very general sense? Like, what were the ways that you were you, and you did the kind of problems you might have faced because of your identification? And for those of the young people, especially who are going to the workforce, who are worried about facing discrimination at workforce due to their SOGIs, what advice would you have for them?
Oh, thanks. Yeah, when I came back from after completing my studies and started and entered the workforce and the ministry, I tell you, I didn't receive any difficulties with people that I work with, and there was none. I didn't even experience or face any. Like I said, the time is evolving, and as health workers, I think we will be we should be leading in terms of work that we have of equality, and providing the services that we do to be inclusive with everybody. And I believe in that. And there were people that were before me that came and started working, and I didn't even hear any issues with them here in Tonga about any a problem that they face because of their identity and what they and who they are in terms of their work. And then I followed them, and then there were people who followed me after and joined the workforce. And again, no problem were faced, and I haven't heard any complaint. What we did, what we were doing at the time is that we were focusing on what we were there to do in the ministry. We're all there to save lives. And I think when we went in as a doctor or a nurse or whatever department or divisions that you're working in the ministry, your focus is your work and what your line work is you're supposed to do, and you're doing your best in what you're doing, you earn the respect from your colleagues and the people around you. And when you keep on doing what is needed to be done and you're doing it well, I'm pretty sure that, you know, those the feeling of rejections and feelings of, you know, of creating barriers and things like that from your colleagues and everybody is going to fade away, and it will no longer be there. It's because of that, which I believe that's what actually happened to me. I was focusing on work, getting the things done, and also trying to enjoy the environment that you're entering and the workforce that you're actually are joining. And that's how it just kicks out, it just push away barriers and things like that away from me. I like I mentioned earlier, didn't come across any difficulties. So my advice for the young ones who are listening and those who are coming, who are going to join the workforce later on, be yourself. I think when you come back, I mean, be who you are, and and try to excel in whatever you do, because that's what takes you across and pushes you through barriers. Is constant focus on yourself, focus on the work that you do, focus on the people that actually appreciate what you're doing, and because at the end of the day, it's you and those people who are going to walk slowly and go far. So you don't have to, put yourself down, or be scared that you're about to enter a workforce where we have with a lot of people. Of course, you have people that were before you. They have experience in the work that we do, but then that's life. We get to face it. Whatever we go through in life, we have to face it. Whether if it's good or bad, that's how we learn from it and we move on. And so that's just my advice to those who are coming, our future healthcare workers who are listening or about to enter the workforce. Be yourself and do your best in whatever you do and try to excel with it. It will take you far. And don't forget to respect the people that were there before, and that's also a key that you have to also take in with you and consider it. Thank you, Abdul.
Oh, I absolutely love your response, and I was just looking at the screen and I saw a few heart emojis on the screen, and I feel the listeners love your response. So thank you so much for that. I have a question on young people, and then I might ask the person who asked the question to expand on her next question, which she has posed to me. So the question is, in general, there are young people who are not part of the LGBT community, but who wish to support, who wish to be, allies of the movement and the community. How can these young people support and amplify the voices and the priorities of the LGBT community?
Okay, thank you. I get those questions a lot. Most of the time when we have discussions with the community, how can they help those who with such as LGBT communities here in Tonga? Okay, then if as far as I know, the Tonga Ladies Association, they do not they don't accept or they don't what's the word? They don't reject people who wants to help and wants to join the association because of their gender. If you're not consider yourself as part of the community and you really wanted to participate, I encourage you to do so. To join in, or you can just walk into the drop-in center and see what you can do to help out. there are activities that they're planning, and they are running those activities in a yearly basis. Some they participate in those activities even though they are not part of the community themselves. I'll take one example. Is that one of the examples of the activity that they usually do every year to celebrate Pride? They conduct a pageant, just like how is it like there in Fiji, and their pageant they do it with they have themes, and then they do it with a message. One of their pageant that they did in the previous years is um, uh, they they did their pageant together with their condom campaign as part of their what you call it, health promotion and outreach. And again, these were done from the Tonga ladies, but then the support from the people were surprisingly amazing. They participate in terms of just attending the pageant. Because they in the past they were very constrictive. They were just doing the pageants and their activities for the Tongaletis for themselves and their community themselves, because they were worried that the others might not accept what they were doing. And then the time goes by and the years goes by. They've changed the mentality, and now they're doing their pageant, and they're openly inviting to the population of Tonga, whoever wants to join. They can watch, they can come into the activities and all. And that is one way that you can actually contribute, and you can actually help with the LGBT movement here in the kingdom. You can participate, help, support, or even just you turning up to an event that have been organized and set up by this community here in Tonga. That's just it. It just shows you're attending. It makes a difference to the lives of these people, that they feel appreciated. So that's what I encourage for people, for the non-LGBT community, if they are listening. If you want to help out, that's what you can ask for, or you can participate. Is that look for the activities that they are doing throughout the whole year. They have their program and their activities planned throughout the whole year, such as festive activities like this. They have market day. They have an open day from their shopping center. Maybe I'm just exaggerating with all these activities, but that's what they've been planning to do throughout the whole year. And I tend to participate in some of the activities when I have the time, because of work related. And sometimes I don't attend, but I just send them a message and support them via text, or put a post on Facebook or things like that. And that's another way that you can participate, is giving good comments on social media. If you see all the activities coming up on social media, you can just say something on that, rather than getting negativity and having all those comments online for them. I think it's better if you can just send them a positive message across. That is also another area that you can contribute, support, and you can push through with the LGBT movement, even though you're not a part of the community yourself. Yeah, so I encourage to do that. Positivity makes people live longer and happier. Thanks, Abdul.
Thank you, Dr. Joe. No, I've got, I think I've got a participant from Tonga, if I'm not wrong. It's Stephanie Mataele, and I'm going to ask the lady if she could put Stephanie on the mic. And Stephanie just wants to give our little message on her youth group and their interest in LGBT. So I would let Stephanie be on the mic, the lady.
Thank you so much, Abdul. Hello, everyone. So my name is Stephanie Mataele. Hello, Joseph. Fefe. Okay, so I just want to say thank you first and foremost. So I was just speaking to Abdul regarding a platform that I help run, which is called Bota Talamuni, where we use the platform for discussions from a youthful perspective. And we're pretty much just interested in engaging youths in conversations about social issues and the LGBTQ community being one of them. So pretty much, thank you, Joseph, for answering the question. You've covered all the basics that I needed because we wanted to see what your thoughts were regarding how we as a youth, especially the youth of Tonga, can assist and engage to provide support, especially with the upcoming and LGBTQ community that we have back at home. And also just another question, especially with the health sector, in regards to HIV, STIs, etc. What would your thoughts be for us youth to, what else we can help with that, in that part of things? And also another thing is, before I do finish off speaking, we just hope that the initiative that we've brought up with both the Talamonumui will further help the community, especially with the LGBTQT community back at home. Koia be malo.
Abdul, can I can talk straight to Stephanie? Is that okay?
Yep.
Okay.
Yep.
All right. Thank you, Stephanie, for coming in, and I really appreciate the effort that you're putting in for our youth, and with me, like anything that has to do with youth program, I fully support. But I think you didn't mention, Stephanie, where your program is here in Tonga, or some maybe because I didn't get that from your message. But then wherever you are, and you're seeking help from a health perspective in terms of a youth program, I supported that. I'll give you this information. Perhaps maybe later on we can continue the conversations.
Thank you.
The target age group that you can focus your program in, I suggest if you can focus on the age group of 15 to 24, or you can go above to the age of 34. The reason why I want to emphasize on that, because we've got data and information based on this age group has the problematic one. Our STI cases that we see annually in a yearly basis, we've seen a lot of the cases that we encounter is between that age group. And what we're doing in our future plan for the ministry with other agencies is to target that age group with our activities in our program. So I suggest you do the same. That's the kind of the age group that I can provide you with that information. The second one is that keep on talking on push through information such as health education, because on safe sex, if I must put it that way. There are still what you call it, minimum knowledge and information on safe sex. They laugh about it. Like if you sit down with someone who's 17, from a boy who's 17 or 18 who just finished from high school, and you talk on safe sex to them, they laugh at it, because they think that it's still, it's a topic or a conversation that you can wait until you're in adults and things like that, and you talk about it. But no, because we see cases who come in, they are still in high school or just finished from high school, and they've experienced such signs and symptoms of STIs. We don't need that. The reason why they're ending up with illnesses is because they don't know. The information is not being taught to them, and so forth. So I challenge you and your program to continue the conversation and try to break that barrier of saying that I'm young, I'm still a student, I don't need to know about condom and things like that. Program should be based on that. Okay, to start off with, and we can continue our conversation from there, Stephanie, if you want.
All right, perfect.
Thank you.
Thank you.
Thank you, Stephanie, and thank you, Dr. Joe. So, see, this is the reason why we are having these conversations, because we want to see if young people can engage with the movement more, can get to know the movement more, and to see Stephanie's project, the youth platform, and Dr. Joe with the information that he has given. This is really fulfilling the objective that we want. So please, if any of you on this call wishes to send a message with regards to something you want to tell us with, that your organization or your group is working for LGBT, or you want to ask Dr. Joe a question, please do. Because Dr. Joe mentioned this, and I've got two questions. So if you send me the question, I will definitely ask it. But I had a follow-up question. You mentioned about the age group that show up for, with show up with signs and symptoms of STI because there's a lack of information, or they grow up with that mindset that I'm too young, but they still engage in sexual activities. So, very basic question: how important is sex education in schools, and what is the outlook of sex education in Tonga? Is it comprehensive? Is it barely there? What are the improvements that can be made?
I knew you were going to ask that question when I mentioned it, but I'll just share with you what's going on now. I'm still in the country. Yeah, that's the mindset that we are actually facing right now. The government, actually, the Ministry of Education before, they have included talking about having sex educations and sexual and reproductive health as part of the curriculum in the past. I think they call it the family educations it was one of the syllabus, and it was stopped recently. I don't know what actually happened, but I just heard from a recent source that they're developing their material now and try to include it again in the curriculum for schools to talk about it in schools. It's one of the sensitive and vital topics that were discussed on and off in the past, trying to address this in a younger target age group, which high school students. And it was a bad battle in the past. Like I said before, it was on and off conversations on whether to include it in the system or not. But that's where we are here in Tonga. Recently, I just heard that they're actually putting back they're trying to put it back to develop the system to teach it in school from the Ministry of Education. But in terms of what what we're looking at right now is that we have cases who come in at that age. Whenever we had a sit down and conversation with them, trying to get more information out of them, they mentioned that as an excuse, saying that they're not being taught in school. They were not aware of it because of they were of the lack of the informations that were supposed to be given to them were not. So that's what the feeling that we get, and that's what the vibe that is being provided by these age, as I mentioned. But nevertheless, we still continue with what we're doing. After we still, if they are sick and present with symptoms, we treat it. But at the same time, we do our counseling and making sure that they are, they are being the service is provided to them. Make sure that they're actually doing it with our safe educations, discussing with them in that stage. Yeah? And they ended up, some of them ended up abiding with what we advised them, and some do not. But then we kept on pushing with what we're doing. It's very difficult with that age group to work with them. But then, like I said, we have a team in the hospital that not just myself, but I have others as well. Whoever that feel comfortable, it depends on the clients, comfortable to develop the record and have that relationship with the clients for treatment and also the continuation of management. We'll take it from there, and then that's how I think that's what we're currently doing now. But hopefully, this thing that we're hoping for the Ministry of Education to put into the schools can work, and I'm pretty sure, we're going to support that and continue from there.
Yeah. So just a minor add to that, and then I have someone else who wants to speak. So when I talk about sex education, I was also wondering, are there any possibilities of including about SOGIs or LGBT gender identity? Because what happens most of the time is when young kids do not know on how to self-identify, why they feel a certain way or why they think a certain way, but they're being taught the binary, heteronormative, male, female, men and woman kind of sex education. It can be really confusing, but because then they grow up, they become adults, they come to universities, they leave their country, for example, in the region, they come to USP or they come to FNU or they go to another university. then they're told, oh, you're free to do what you want. But there is 18 years of being told to, confine yourself into the binary that you have to then unpack for the rest of your life. What are the chances, one, of the inclusion of these kind of topics in education? And your personal perspective, how important do you think this is?
Thanks. That's another hard one. That's the target. That's the target that we wanted to actually establish. But then again, we have to start slowly, Abdul. Like I mentioned, we have to start putting the information, the thing to system. The system works, and then slowly, step by step, getting from there. So we have to start putting it to work, and then we will develop and continue from there. So yeah, I think I'll get back to that question in a few years' time. But then again, that's the aim that we wanted to include. But at the moment, like I said, this is what we're pushing for the government to do. But then the LGBTI, the TLA, the Tonga Ladies Association, they are doing their own education, and surprisingly, they get participant from high school participating in their workshops and their trainings. And I was invited. I'll give you an example. I was invited to one of their retreat last year, and I walked in and I was shocked when I asked the participants to introduce themselves. And some of the participants said they're still in high school and they are young LGBT community members who are still in Form 6 and finishing high school. And I was happy that they actually managed to do that. See, like I said, work is on what you call in process on doing that. So to taking one step at a time, but we'll get there, Abdul, for sure. I'm just looking at Dylan's name, and I mentioned it when I talked to you, Abdul.
Yeah, but that's a very good answer, actually, and something that I think even myself I did not consider when I asked you the question, that there are informal spaces of education that might not necessarily come from the confines of a classroom, but there are people and there are organizations out there who are doing their outreach. So that's something that needs to be taken into consideration. Now, I've got two people, I think, who want to ask the question. I'm going to invite Sarah Lala, and Tele, if you could put Sarah on the mic. I think she has a feedback, comment, or question.
Yep, she's
Sarah?
on. Go ahead, Sarah.
I'm already on, Abdul. So hi, everyone. Bula Dr. Joseph. My name is Sarah Lala. I'm currently a fifth-year medical student here in Fiji. It's not a question, just a comment. After hearing you on the progress of healthcare and the reception of the community in general toward the LGBT community, it's been very uplifting to hear it, and I absolutely love it. So throughout my study, it's definitely been an area of interest, especially having to tailor make our healthcare to best provide for the LGBT community, whether it's in sexual reproductive health or mental health, especially mental health. I'm also with Stephanie for the Talanoa Mui. And so thank you for the information that you provided for us tonight. Malalahi, and I look forward to working with you in the future, especially for our community. Thank you.
Thanks, Sarah. Yeah, I thank you for taking the courage to actually do that, and I fully support that. And I cannot wait to work with such very dedicated, enthusiastic young medical disease. Oh, yeah, I'm looking forward for that, and that's what we all want from here, from our side. Our staff, we're getting into the understanding, like I mentioned before. So I can't go above to the age group, older generations. What I can do is advocate on my level and the young ones to make sure that we can do change. We can do something that we can. It's some spice up the workforce with whatever we do. So I'm looking forward, Sarah. Continue what you are doing, and all the best with school. I know fifth year is the challenging year, but then I know you can do really well for sure. Thank you.
I wonder if anybody else is getting that warm, fuzzy feeling from this conversation, because I'm really happy with the conversation we've been having so far. We've just reached the 1 hour mark, and we want to continue this conversation for maybe the next 15, max 20 minutes. I've got 2 more people that I will bring on in a while.
So I think,
yeah.
I also have to run as well, but then, I can take the questions from the other 2 before we continue.
Yeah, well, what I'll do is I will get Langi. I had requested Langi to share something, and then I'll get Miki to do a quick 5 minutes on something that she wants to say. So, Tele, can you get Langi? Langi wants to just share something with regards to a similar concept to, I think, what Stephanie was doing.
Thank you so much, Dr. Joseph. Thank you, Abdul, and the team for organizing this. I just wanted to share about a document that that was commissioned or produced by the Pacific Sexual and Gender Diversity Network, which is sort of the umbrella body for SOGI-esque organizations or LGBTQI organizations in the Pacific. And I see that Miki is also on the call, and she and I worked on this document, which sort of captured some of the emerging issues, but also some of the the issues that have been faced by LGBTQI young people over the years in the Pacific, and so it's in 3 parts, and I see that it's just been shared on the chat. So the first one covered voices and representation, and the second is on the theme of self-determination, and the third one, which probably would be relevant to the discussion that we are having tonight, is around access to services. And so there was a lot of things that Dr. Joseph had shared, which resonated with the document. And one of the things about this policy document is that you could really just pick it up and use it in whatever spaces, policy spaces, or decision-making spaces to sort of lobby for inclusive, SOGI-esque practices, policies, and even programs. And one of the things I might have missed, because I was walking around the house while I was listening to this, but one of the challenges with regards to young people not being able to access friendly health services or any other services for that matter has to do with the lack of investment by government, but also from development partners and some civil society organizations that are providing these services. And part of the reason to that is because for any action to take place, it needs to be informed by data, and that's something that we lack in the Pacific. We do not have, we lack disaggregated data and information about LGBTQI youth. We lack evidence-based researches on persons of diverse SOGI-esque in the Pacific in general, and so as a result of that, whoever advocates are unable to use that to lobby governments for increasing investment, for increasing support, so that young people are able to not only afford but able to access services that are friendly to them. So I hope that it will be of interest to you, this particular youth policy paper. So please have a read and let us know, either myself or Miki, if you have anything else that might have been of interest, a specific theme or topic that we could also bring to the attention of PSGTN, so that we can develop more of these evidence-based papers and researches. Thank you.
Langi, just a second. Is there an email address that people could reach out to in the document?
Yes, so I'll probably drop the email on the chat, and feel free to reach out.
Yeah. So in case you are unable to download the document that we just put in the chat for your information, you could always reach out to Langi or whoever's email is going to be put in the group chat. to ask for a copy. Thank you so much for that, Langi. I'm sorry, Dr. Joseph, I'm just going to have Mickey on before we close so that this is recorded as part of this call. Mickey, you had a question, comment?
Okay, good evening.
So this is really good for us in terms of this chat because, yes. Go ahead, Mickey.
Okay. Just let me know when you're ready. And so, good evening. I just want to take a moment to also share my whakapapa to Dr. Joseph and the TLA team and all the work that is happening in Tonga Tapu and across the region during such critical times of what it is to see pain and trauma, but at the same time, what it means to also show resilience. It is pride, and despite the fact that the world is going through so much situations of fracture, we still have young people that are still co-creating realities in relation to what change do people want to see in their own communities and countries across Oceania. And so, with that being said, I just wanted to say that this is very much noted to the work that Abdullah Vikash and many of you are part of the Youth Council under the American Embassy here in the Pacific, in Fiji. And this work is very important. So congratulations, and just to share some acknowledgement to the work that you all have been able to be part of and to move this work forward. I just have some reflections really to share. As I've heard from what Dr. Joseph has mentioned, I guess by now we all know that there's a need for change, and that's paramount, and not because of the moral dimensions of all forms of discrimination, but because in the case of the pandemic, lives have been at risk, and we've seen how in many countries of the world, especially in the South, how people have lost their lives. Here in the Pacific, in countries like Fiji, and also in Tonga and Samoa and many other parts of the Pacific, livelihoods of our own community have been ruined in so many different ways. So we do. And if we don't change the way we respond to COVID, the consequences will be that there will be more people in our own community that will be hungry and homeless and jobless, etc. And ultimately, more members in our community will also face an existential death, kind of like a threat. I was going to say death threat, excuse me. I think we pretty quickly also disabuse ourselves of the notion that the pandemic was the greater leveler, but the disparities have been very significant. So what that means for me is that we have to design, and this is the pain, you have to keep redesigning systems and structures such as public health interventions that acknowledge the diversity and differences in our community. And just very lastly, in 30 seconds, while it is essential to acknowledge the differences that we reside in, we don't live in a colorblind society. So we don't live in a society now, a world that is free from discrimination. We don't live in a world that can be allowed to be so naive as to pretend that these inequalities don't exist. One thing is for sure, and I like how the climate change young activists of the Pacific have put out very early in the past decade, that we're not drowning, we are fighting. And that's also to say that in our own community as queer people of Oceania, we acknowledge the fact that we can either drown together, or we can swim together. And that's important for us to know during the pandemic. The systems and structures need to really, really rethink how it needs to work for its people. Domesticating human rights practices in countries of the Pacific Islands is very important. So with those words, I just thought of sharing just sort of like a regional perspective in terms of what I've been able to document with a few other colleagues that work across the region, not just through the PhDN, but also through ILGA Oceania. And so with that being mentioned, I do also just want to say thank you again, Edmalo, to TLA for the great work that it's doing across the region during these times. And it's good to know that solidarity and support and movement building solidarity is still something that many queer communities and activists and peer-to-peer people are showing towards each other, and that's important. Because if the governments won't do it, we will do it.
Thank you, Mickey, for the very strong message and the idea that we need to create some changes which is inclusive for all communities, especially those who are vulnerable. We are reaching the end. We have slightly gone over time, which is totally fine because the conversation is amazing. And as usual, we have lots of questions that we still want to answer. But I'm going to ask one last question to Joseph, which is, with everything that we have discussed and with everything that we don't have the time to discuss, what are your last few words for young people for the school who want to be better allies? What are your words for the LGBT community who are out there struggling because of COVID or because of any other socioeconomic, geographical, political reasons?
Oh, thank you, Abdul. Before I'll say a few words on that, I would like to take this opportunity to echo and also to mention what to appreciate what Lady Mickey have shared. Such a very strong, and I could hear I could sense from just her message that she's a very, very strong advocate on the community, and I would like to also thank you for what you're doing for the region and also for the islanders in general. I will make sure that I'll take your message that you mentioned to the Tonga Ladies. I'm not part of the executive for Tonga Ladies Association. I'm just a member of the TLA, and I strongly support 100% what they're doing. But then what you shared earlier, very, very appreciated, and we would like to send our regards from the warm islands of Tonga to you, and all the best, and encouraged to continue what you're doing. Coming to what Abdullah asked about the what my last sharing message to the listeners. I think what I can just say is that in order for you to survive in what's going on in the world in general, not just the pandemic, but also whatever the difficulties that you're facing, you have to stand up and look for help, because help is provided everywhere. It's just that you have to reach out for it. You're not just going to stay alone and while you're suffering, and you think that you will receive or get anything from there. You just have to I encourage you to speak up, to stand, to search for look for it, look for help if you need it, and reach out. That's my message that I wanted to end it with. Most of the time we don't realize that our community, such as LGBT communities, people tend to go through things, and some they are willing to share, and some they are not. They're hesitant to do so because of factors in the things that they're going through. But what I always encourage those people to, you can do something about it. Come out of your shells and be who you are, and don't be afraid to talk about it. Share, because what we're going through in life, you're not the only one. You'll be surprised to find out that you have other people in the society or the community that are going through the same. It's just a matter of opening up and reaching out and get to see what's going on in the outside world. So with that, I'll end with my my talk today by thanking everybody, the organizers, and for the opportunity. I really appreciate it, and any if we're going to do this again, or maybe later on, I'll be happy to be a part of it. I wish you all the best with our listeners, with all your work that you're doing. If you're a student, wish you all the best with your studies. If you work, like what Langi shared earlier, that is a great project or moment that you're doing with the people that you're working in partners with. Continue the good job, and for everyone who's listening, a greeting again from the island. Stay safe out there, especially what's going on, the pandemic in Fiji and everywhere in the world. We're praying for you, and let's just hope that this will end and we'll be able to see each other face to face. Ofatu from Tonga, malo opit.
Thank you so much, Dr. Joseph. This has been an amazing conversation. A lot of information has been shared. So I will continue talking. And while we are doing that, if you want to be part of a group selfie, a e-selfie, you can turn on your camera and sort yourself out, and Talay will tell us when she's ready to take the photo. And while that's happening, maybe if Venus, I'm putting Venus on the spot here, if Venus wants to just say some words. Thank you so much, Dr. Joseph, for agreeing to be part of this panel. We were supposed to have another caller, but because of internet connection, I suppose that they haven't been able to join, but you carried the conversation amazingly, and the information that was shared, I feel, was very vital, especially for young people, in how to be good allies. We'll give it to Venus, and then Tele will take a photo, and then we'll be done. Venus.
Thank you. Thank you very much for this opportunity. Dr. Joseph, you have been an amazing at portraying the situation in Tonga is for the LGBTQ plus community. So this has been an eye-opener, and we thank you for your time and for your expertise, for sharing your expertise with us. We really are grateful for this, and I cannot say something more than what has already been said. Abdul, you pretty much narrowed down everything I wanted to say. I appreciate that. Thank you again, Dr. Joseph, for doing this with us and being with us today, despite your very busy schedule.
Yeah, and Venus is the acting head, I think, of the public diplomacy section at the embassy. Last word from me. Please stay tuned for our next and last session for the Pride Month, which will happen next week, Sunday, where we'll close off. We'll have our posters up on the US Embassy Facebook and Twitter page, hopefully by Tuesday or Wednesday latest. And over to you, Talay. Thank you.